Hello everyone, my name is Dr. Yusuf Beintaris. I'm one of the consultant gastroenterologists at Northeast Hospital. I will briefly walk you through the concept of the Serious Non-Specific Rapid Diagnostic Service, or RDS, which is about to go live in our hospital starting from December 2021. Why there is a need for such a service? Obviously, cancer diagnoses have been rising significantly in the UK over the last few years. In fact, there are reports stating we anticipate about a 30% increase in cancer diagnosis over the next 7 years up to 2028. The aim of the RDS is to serve patients whose symptoms do not necessarily and clearly fit criteria of well-established two-way weight cancer pathways. These patients often end up going back and forth between specialities in primary and secondary care without reaching a diagnosis. The aim of our service is to bring this patient in to have the appropriate investigations with excellent communications in order to reach a diagnosis which might be sinister or not. So the RDS model is based on some key elements that are crucial to the patient's experience and eventual diagnosis. First of all, primary care colleagues, you have to identify patients that will fit the criterion, and I will briefly walk you through the criteria in a minute, and then perform a timely referral to our service following completion of a few first-tier tests, which I'm also going to describe to you in the next 2 minutes. It is the duty of the GP to broadly assess their symptoms and try to reach a potential diagnosis. Our goal is then to pick up these referrals, coordinate the patient's testing in a very efficient manner to prevent any untoward delays, chase the results, and give the patient a diagnosis, either benign or malignant. If we identify any serious pathology which is not a cancer but still requires investigations, the RDS team will make sure these patients are streamlined into the appropriate specialty or discuss with you if a routine referral needs to be performed as appropriately. Throughout this journey, the patient will be kept in the loop with any developments, including appointment times, test results, and eventually their diagnosis and further care. The referral criteria for the serious non-specific symptoms RDS will apply to patients 40 years of age or older who present with new unexplained and unintentional weight loss, particularly those who have lost more than 5% of their body weight recently over the last 3 months, or where their GP has a strong clinical suspicion of their weight loss being significant. The second major criterion is that of new unexplained and non-specific vague abdominal pain, or unexplained bony pain of recent onset, particularly those patients with pain that lasts for 4 weeks or more. The third criterion is that of patients with new unexplained constitutional symptoms, so like loss of appetite and unexplained tiredness and fatigue, nausea, malaise or bloating of 4 weeks or more. It is important to know that these time frames are rather arbitrary. Obviously, if the patient's GP, you are very concerned about the patient's clinical situation, then we can always discuss and accept these patients for further investigation under the RDS. Finally, and perhaps more importantly, most importantly, is the criterion of your gut feeling that something is happening with your patient. If you feel the patient may be harboring a significant diagnosis and you cannot fit the patient into one of the well-established pathways, then the RDS is here to help you with these patients. One more criterion that's also important in our current practice is that patients often have imaging, including cross-sectional imaging like CTs and MRIs in primary care for a reason, and results suggest the presence of a cancer. These patients are eligible to be referred to the rapid diagnostic service. Which patients may not be appropriate for referral into this pathway? Patients who have alarming symptoms that otherwise fit one of the well-established two-week weight cancer referral criteria, patients who are too unwell or have social circumstances that make them unable to attend for timely investigation into the hospital, or patients who are already being investigated by a specific team in order to avoid duplication and ultimately patient confusion and cause poor experience. In the available RDS serious non-specific referral form, which is essentially a 2-week wait form that will look familiar when you review it, you will see there are some tests that we require for you in primary care to perform, so for us to streamline the patient's care in a more efficient manner. These are fairly simple tests, including blood tests and basic scans like a chest X-ray. And the dataset also includes some optional tests that may only apply to specific contexts. For example, a patient with anemia, in a patient with anemia, it's very useful for us to have the hematinics in place when we receive the referral in secondary care. One thing I wanted to provide some more information about is the fact that there is a new combined GI symptoms 2-week wait referral form, as you are aware, in the community for use by primary care. There is a degree of overlap between these two forms, the combined GI one and the RDS serious non-specific one, with regards to the symptoms of pain and weight loss. As you will see on the GI combined form, there is a recommendation that the patients need to be referred to the RDS SNSS pathway ideally instead of the combined GI pathway if they don't have any specific gastrointestinal symptoms of note. We thank you very much for collaborating with us for the benefit of our patients. Our team will always be open for discussion in case you have any general questions or any specific ones, obviously on a case-to-case basis. Our plan is to send some material to all GP practices, including our pathways, our timeframes, the referral forms, and anything else that we feel may be useful for this first rolling phase of the project. Thank you very much.